so I know y'all got so much information, so much food in your bellies, but we still have more healthcare alternatives. Healthcare is so cheap in America. All right, so as y'all know, one of our great sponsors is ACN, All Communications Network. Anybody know the highest form of compensation is communication? And whether it's true or whether it's a good thing or a bad thing, I don't know. But who is, like, let's say a roof got sold. Y'all ever seen somebody get a roof, right? Do you know who made the lowest amount of money on that chain? The person actually nailing the roof, shingling the roof. But the salesperson that communicated to the homeowner that we can fix it. The roofing company owner that communicated to the vendors and all of these permit people. When you communicate, the highest form of compensation is communication. So when I run into ACN and they have a name like All Communications Network, and I know how this works. Why you keep like, what? It's an inside joke about the name. Am I saying, is that the right name?
Yes.
All right. She knows something. Because every time I say the name, she laughs, right? Hey, but All Communications Network is ACN. They're definitely been some great people, and I know y'all met them, and I'm looking forward to them sharing this knowledge to y'all. Everybody, please give it up for ACN.
Good evening, everyone. How you doing? Good evening. A question. My name is Jessie Ferrell. Let me see the hands of everyone that got that notification that their insurance was going through the roof.
Did anyone health insurance go through, got an increase? Say it's gonna be increasing for 2026? How many say, wow? Wow. How many said some more Trump choice words, but they didn't say wow? Wow. Well, we are here with Impact, and it's an alternative to high insurance, health insurance. And we're here today to go into a little bit details of how it works and how you can take advantage of some health care we save people money on this Impact, and the person that I'm gonna introduce to explain how it actually works. She come out of the financial institution, and she knows a lot about numbers, so she knows about saving some money. And so when she was introduced to ACN, which also do Impact, she was really excited by the saving that she can save people on a health insurance. So please welcome to the front of the room, my business partner, Ms. Lorrain Alleyne.
Thank you very much, Mr. Farrell. So, healthcare, we have come to give you good news when it comes to healthcare, which is so exciting because for so many people, you're hearing so many things that are in the news that's like, oh my gosh, what's happening? How are we going to afford? In fact, Ms. Farrell, we had a customer, and I spoke with her last week, and she said, I got my premium notice, and it's going to be $40,000 for 2026. She said, I could throw up. She said, I told my husband, we're not doing healthcare this year. So we were able to give her a quote for $605. And she said, is that for me and my husband? I said, yes, for both. She thought it was for them individually. I said, no, that's for both of you. And she was like, wow, how come your numbers are so low? And we explained to her how it comes together. So when I say we're here to bring good news, we're here to bring great news. You know, obviously the good news is the gospel, right? Yes, but as far as healthcare, this is the gospel, I'm telling you. So let me get into some of the information. We have a video here from a gentleman by the name of Phil Chrysler. He is the president and CEO. So just what to expect, we have a panel here of folks that are one on the team, two that are actually using Impact Health Sharing. This has been the only health sharing or healthcare that I've used for the past 3 years. And this is a kind of side note. I was in the marketplace and I had Ambetter. I was paying $80 a month for Ambetter. If I kept the same plan come January, I would be paying $916 just for myself, not even including my husband. So to see what we're able to do now with this, and it's not cheap insurance, It actually provides medical freedom to people. So doctors didn't go to school to practice insurance, they went to school to practice medicine. This allows them to do just that. So Impact doesn't get into utilization reviews. In other words, if a doctor says you need something, many times what happens, the insurance company says, well, they should try this, they should do this. I was speaking with someone who became a customer. I belong to an organization called BNI. Anyone know what BNI is? It's Business Network International. It's the largest networking organization there is in the world, about maybe 330,000 people that belong to that worldwide. So I was speaking to her and I was telling her about the Impact has no utilization reviews. It doesn't get into someone in the cubicle saying, you don't get this, Michelle, or Peter, you get this. So she said that happened to my sister-in-law. She said she had cancer, B cancer, and then she just wasn't feeling good. And she kept saying she needed to go to the doctor, and she kept asking them for tests, and they would not give her the test. And she said, finally, 6 months later, when they gave her the test, the cancer had already spread, and she died within 6 weeks. See, the thing with Impact is, when I say it gives you medical freedom, if you feel you need something, you go to the hospital, you go to the doctor, you go where you need to go. And the thing is that you have choices. A lot of people right now are doing things in a holistic fashion. Some people, I went to my eye doctor and we talked and I said, we talked about this whole COVID thing and blah, 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 blah. And I said, something I said to him, and he said, I think the medical community really shot themselves in the foot the way they handle certain things. And he said, I don't trust doctors. And I said, but you're a doctor. He said, I know that's a problem. Okay? Think about it. If the medical community is saying, I don't trust my colleagues, what does that mean? Okay? So to me, to be able to come on the scene, Impact, the industry of health sharing has been around for 40 years. Impact Health Sharing in January will make 6 years since Impact has been in business. There has never been an across-the-board increase. That is really good news because a lot of people are seeing increases in their premiums right now. So let me get into, have you listened to Phil Chrysler? He's going to talk about what this is and how it differs from health insurance, and then we'll go from there.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing has brought freedom to many Americans who are looking for change, and we are happy to be part of this movement. Because healthcare sharing organizations are not insurance, we are not able to offer a guarantee that eligible medical bills will be paid. Does that make you nervous? Let's take a look at why this is and perhaps alleviate some of your concerns. Members join a healthcare sharing organization like Impact to be part of something bigger. They join and agree to share each other's eligible medical bills. So Impact itself doesn't do the sharing. We simply facilitate on our members' behalf through an industry-leading platform which provides transparency. My friends, something long overdue. Think of it this way. Healthcare sharing is a risk versus reward concept. People have been helping other people in communities since the dawn of time and will continue to do so. Before grocery delivery services came about, you just knocked on your neighbor's door for some sugar. But because of technology, we can now help one another in a more meaningful, better way. The reward typically is saving 30 to 50% on your healthcare. My friends, that's huge. These decentralized democratization business models continue to disrupt traditional thinking and industries. However, if this approach is just too risky for someone, then they can continue to rely on a for-profit insurance company that has been formed and is tasked to maximize shareholder value. That means they need to put the profits of that entity as a priority over its members. Let me ask you a question. If the so-called guaranteed approach was successful and is working, then why is medical debt the #1 reason for families filing for bankruptcy? There are over 100 million Americans in medical debt today, and that tells us something is broken. At Impact, we are all about solutions, and together, as a community committed to sharing, we can keep one another out of debt and put your money into something we believe in. Each other.
Sure, I love that part. Putting our money into something we believe in. And just like what Michelle was talking about.
Microphone.
Oh, thank you very much. Just like what Michelle was talking about, putting your money into other vehicles, setting yourself up for retirement, that type of thing. So there's several things that are converging that's causing people to really take notice. One, you have the COVID era tax subsidies that are going away. The other thing is happening is you have the largest increase as far as insurance companies with health insurance is concerned, and that's taking place as well. So it's not insurance, it's something better. There's no provider restrictions, which means you can go to any doctor that you want to go to. Comprehensive healthcare, no utilization review, as I talked about already. This is the thing. Let me have Dr. Joyce. She actually went to Mayo Clinic, because sometimes people think, oh, well, you can't go to a certain doctor. So when we talk about no network restrictions, you can literally go any city, any state. So Dr. Joyce, if you would share a bit about how you experience using Impact Health Sharing.
Okay. Good evening. Good evening, everyone. Okay, so I had the privilege of using Impact Health Sharing, and I could not wait until Medicare age, because as you know, they say Medicare is your best insurance. So anyway, I was going to Dallas. I just joined Impact Health Sharing back in February. And then I was going to Dallas, Texas, and my eyes were really red. So I decided to go to Mayo emergency room at midnight. Because I'm thinking at that time the traffic is really light. So I would get over to Mayo, I would not have to spend a long time. So I called Lorraine, and she said to me, why are you going to Mayo? And I said, well, my eye is really red and I want to go check it out. And she said, why don't you call up Impact? Why don't you just put the information in? Because of course they have, the virtual visit. So I did put the information in, and then within 2 to 3 minutes later, the doctor called me. I was able to upload, took a picture, uploaded, and the doctor called me. So he prescribed, he just asked me, if I'm allergic to anything, what pharmacy do I use? And before you know it, he sent the medication to the pharmacy. My husband was able to get it. So he went to get the medicine, and I said to him, hey, don't give them my Medicare card, my Impact Health Sharing. I said, give them Medicare and see what happened. So when he did, the medicine was about $25, but when he gave them Impact card afterwards, it was only $14.95. Big difference. Now, so I went to Mayo about 3 days later because I wanted to really let someone touch it, I was on the phone and I'm thinking, let me go to Mayo. I went to Mayo, spent about 3 hours in the emergency room, and then all they did was check it, they irrigated the eye, and they were about to give me a prescription, and I pulled it out and I said, this was what I got. I called and the doctor gave me that, and I said, you know what, that's exactly what I was gonna prescribe. Go ahead and use it. Now, here's another testimony that I have. I went to Walgreens pharmacy. I was picking up 2 prescriptions. One was prednisone, the other one was Medrol dose pack. They're both steroid. Because I was having some swelling, and for inflammation, it would really help it, So I went to Walgreens, and it was raining. So I gave them my Impact Health Sharing card, and she said to me, this one medicine is $24.99, the other one is $19.99. How much is that? $44.98, right? I looked back and I said to her, did you check and see if I have a discount on that? And she said, yeah, you have a discount, your Medicare D, you save $2. And I'm like, no. What about my Impact Health Sharing card? So she said, oh, we're not participating provider. I said, yes, you are. So I looked back, it was raining, pouring rain. I looked back, and there were like 6 cars, and I said to her, listen, I'm not moving, I'm gonna stay right here. I need you, I'm pushing, they're pushing me back, I'm pushing forward. I said, go ahead and make that phone call, look at the card, call that number, and let me hear it right now and see what happened. So she did, she had my credit card in the window. So she went down and she repackaged, relabel. And she came back and she shoved it through the window. And I said to her, wait a minute. So what happened? Tell me what happened. She said, oh, one was 98 cents and the other one was free. Guys, can you imagine if I just give the money to Big Pharma, what would happen? They would have taken your money. You'd never know. So impact health sharing, it's phenomenal. It's the kind of plan you need. Regardless of what age you are, there's no limits. Thank you.
Thank you very much, Dr. Joyce. I had a good experience. I've used the telehealth, had a face-to-face with a physician online. They were in prescription, but to Walgreens to pick it up. I asked them how much it was. They said it was $110. Gave them my card. They said $40. So good savings. In fact, we saved our members. I think it was $6 million in 2024. So the plans are comprehensive. So everyone gets a wellness exam. It covers strokes, cancers, so it's totally comprehensive. You get the complimentary annual wellness exam. Everyone gets $150 credit towards their lab work. Also includes vision and dental. It's a community-based support group. And the thing that I really like about it, you have this thing called a vanishing deductible. You all know familiar with the deductible. So every month you get up to $150 credit that reduces that deductible every month up to $1,800 a year. So if you have a primary responsibility amount, which is what we call our deductible, if you have that, that reduces that $2,500 down to $700 cash out of pocket. So pretty powerful what we're able to do. This is actually a massive opportunity to help lots of people because, as I mentioned, there's not been an across the board increase, saving people 30 to 50%. And you can join anytime. Open enrollment has been completed technically on Monday, December 15th, but we actually have open enrollment all year long. So we actually put people over profits. They add more perks. This is the time of Christmas, but they're adding more perks continuously without increasing the cost for us. Concierge service. One of the things that Impact wants is they want the word on the street to be Impact pays. There's some insurance companies, Dr. Joyce, what's the shortest and then what's the longest time it took for an insurance company to pay you as a provider? Dr. Joyce actually has her own health and wellness, her own home healthcare agency for the past 25 years. So if you're talking about time frame, longest and shortest time for an insurance company to pay you.
Okay, so let me talk about Medicare. When we have a patient who's on the Medicare plan, we cannot bill Medicare until 30 days later, 31 days. You're not getting paid, not yet. You're seeing that patient, but you cannot bill the service for 30 to 31 days because it's in period. It's like 30 days and then 30 for the final. Now, you're not going to get paid right away because they'll have to review, look at your notes, look at everything to make sure that this patient, that the service is medically necessary. So you may not get paid until their review period is over, maybe 3 months later. It takes a while. Now, the shortest time you can expect pay is about 37 days because remember, you cannot bill until 30 days, 31. Then you may get paid about 7 days later. So that's 37 days. That's your earliest. And your longest time could be forever. Maybe they deny the claim because they have those utilization review people that review these claims. And remember, they're not even seeing these patients, right? They never see them. But they determine by code what is billable and what you can do. Now with Impact Health Sharing, you're talking about within 7 days. And you will get paid. Because remember with Impact Health Sharing, there's no utilization people. So they don't stop you. If the doctor orders for you to have certain things done, they're gonna honor that. Because they respect their doctors, they know that they're honest, they're providing services that is needed and necessary. So they will not stop you and you will get paid quickly.
Thank you very much. So impact pays generally between 10 to 12 days. So providers love the fact that they get paid really, really quickly. Some of the things that we've added, complimentary short-term therapy, where you can talk to a therapist on a topic 3 times at no additional cost. So you can talk to as many topics as you have, and you can select the same therapist if you like that person. This is coming soon. This actually is now live. We've changed our prescription programming, where if 65% of our prescriptions are $10 or less. So for prescriptions that are $10 or less, it's now 0 cost. And they're actually teaching a strategy to say, if you get like a 90-day supply, consider a 60 or 30-day supply that gets you under that $10 radar, so you don't have to pay anything. I had a gentleman who's a customer of mine on Speed Network the other day, and so he said, well, I have a question about this particular prescription. So we looked it up on the portal, and it was something for his diabetes. It came up as negative $21.20, and I was like, they actually paying him to take the medication. I was like, that's really impressive. Okay, so live vital scan, we're down in Orlando, and they mentioned this. You can actually take your phone, do a selfie, and you'll be able to get several vital signs for yourself. You see that? It says they're measuring the heart rate, breathing, blood pressure, variable heart rate, cardio workload. So I asked the lady, I said, well, how does that work? And she said, well, your skin is translucent, so they can see through, and that's how they get all these readings. I said, how does that work? Because that's kind of scary to think about it. Where's technology advancing to, and what else will they be able to see, sometime soon, right? So a number of things that they do. Telehealth provider, they upgraded the telehealth provider to the integrity. So again, you're able to be face-to-face with a physician, more certified physician that has the ability to write your prescription. How many of you have kids? And they never get sick, between 9 to 5. So it's like late in the night or what have you. So this way you have the ability to have the baby with you, have a little one, and you can actually get tended to. So for yourself, for the kids, whoever is on the plan, you have the ability to be able to do that. So we've talked about deductible, or we call it a primary responsibility amount. People wonder, why are your numbers so affordable? Let me share with you. This is what the for-profit guys look like. Collectively, $22.7 billion on 2013, 10 years later, $70.7 billion. Pay attention to the first guy up there, okay? So you wonder why they're so profitable. Next chart, health insurance claim denial rates. That's how they're so profitable. They're not paying claims. I had someone say to me about impact. He said, I know how those outcomes work. You guys don't pay claims. I said, wrong, that's not our jam. That's not our jam, okay? But when we look at the for-profit guys, that's their jam. That's how they're so profitable, okay? So what we have, you'll never see impact health sharing on this chart because the guidelines are pretty straightforward. They're simple. People understand what's being covered and what's not being shared into, and they don't deny claims. So let's compare the difference. Having monthly premiums, generally speaking, on the traditional health insurance, saving up to 30 to 70% per month. Saving a local business owner about $35,000 for him and his 7 employees. And for his personal situation, he had a $7,000 deductible per person in his family, which means before the insurance company would shake his hand, he had to come out of pocket $28,000 for his 4-person family member. Our primary responsibility amounts, aka deductibles, start at $2,500. So he was now out of pocket $2,500, and the co-share max is at $5,000 out of pocket. So for his entire family, he went from out of pocket of $28,000 to an out of pocket of $7,500. He said, I'm gonna rent his house. In fact, one of my business partners went with me. And I said, well, I didn't come to sell you anything. He said, listen, I want this one right here. I thought, I made it easy, right? Because it sells itself, but people look at what the offering is. I had someone say to me, I thought it was like you see doctors that were down in the basement around the corner of the yard, right? And we have no basements in Florida, right? I said, I used to think the same thing. I said, but after 3 years, after hearing all the testimonies of people going through cancer and reconstructive surgery, having our personal testimonies, here's more testimonies from the folks here up front, it's like, wow, this is for real, this is good stuff. So again, there's no network, so the new card, you get a card, you go to the doctor. Back of the new card says no provider restriction. So it performs and is architected and structured just like traditional insurance. Okay. New network. Great prescription pricing. Our co-share is a 90% impact base once you hit your primary responsibility amount of the deductible, and then be responsible for 10%. And the best thing is it is not based on income. Prices start as low as $73 for individuals, young folks, $378 for families of 3 or more, $96 for seniors. This is what the pricing looks like by age for individual plans. Okay? And for families of 3 or more, again, so you have all of the plans are exactly the same, no matter what deductible person chooses, right? You can choose the 2,500, the 5,000, 7,500, and the 10,000. So no matter which deductible you select, all the plans, they include the wellness exam, they include the from day one prescription pricing. That's great. The doctor, all those things are included. So the only thing you have to select is what amount are you comfortable paying for you and your family for the first 12 months, and what works best with your budget. And you see with the age bands here. So 18 to 25, this would come for a $2,500 deductible. Okay? And this is what you're looking at for families of 3 or more. And the good thing with us is, we have a gentleman who has 13 kids, and he signed up, I saw that face mark. And he signed up, he's a women. All one comes financial covered, but all of them to sign up, to sign up. Everybody gets the wellness exam. Okay, so I talked about advantage deductible. You have the, every month you get up to $150 off of this. Right here. This is the primary responsibility amount. You have the ability to decrease that every month by this here. These are the living value rewards. Okay? So DPC membership. Anybody know what DPC is? DPC is a direct primary physician. Okay? And the DPCs are physicians that were in the hospitals that are tired of the rat race and the big people that they had in the hospital, and they wanted to do things differently. So many of them are becoming DPCs. So it's a membership-based type of situation where, let's say it was Dr. West, he's my physician. So if something's wrong with me, I'm not speaking to the assistant, I'm speaking with Dr. West. I have access to his cell phone 24/7 on him, right? Concierge service type of thing. So we have the ability to reduce a person's primary responsibility amount or deductible by whatever they pay for that membership, up to $150 for the household. You also get naturopathic services. So it decreases by the DPC membership, naturopathic services, naturopathic medications, gym memberships, fitness classes, there's subscription, the Peloton, what have you, massage therapy, acupuncture supplements, anything that you do, even if it's something like maybe a detergent, someone is allergic to something, they need to use a particular detergent, that is also something that comes off of that. So some of the benefits of healthcare, we talked about that already, won't go through here. Here is what the card looks like, a blow up of the card. You see your empty line, zero cost office visit, just performs, looks just like a traditional insurance card. Again, here, the new card on the back which says no provider network. Okay, this EDI Payer ID, while Impact is a not-for-profit, they made the investment to make every payer system in the country. So you can actually use this card anywhere, any city, any state. So you're not locked into just Jacksonville. Anything happens, and let's say maybe for one of your kids, and the best care is maybe Chicago, California, New York, you can go there and utilize this card. So this is Karen, she's actually a friend of mine. She's actually the president of the BNI chapter. She's in Ohio. I'm gonna have her share so that you hear from the hand.
I am Carrie Bixel, and I'm from the Ohio Marketplace. My son had a terrible accident a year ago, and it was life-threatening, and Impact made everything absolutely flawless. The first thing that happened, we had to rush him to the hospital. We didn't know which hospital to go to. We were in between several, and the nice thing is we didn't have to make that choice according to our health provider. We were able to go to choose the one that we wanted, and all I had to do when I walked into the hospital was give them this card. The number is right on the back, and they never asked any questions. And actually, the first hospital was paid within 17 days. It was absolutely incredible. He's fine now, by the way. He, was life-threatening. We did have to go in an ambulance to another hospital, and that hospital, at the moment, took everything, but their billing was difficult. It had nothing to do with Impact. Impact came through for me. Every time I would call, they know me by name. They know my son's case, everything about him, and it's just, they're very personable. So it made the whole experience easy. So for me, it's easy for me to tell other people about Impact because Impact works. It works.
Right here. This is something called reference-based repricing from the panel. I don't know if people are aware of how much markup there are in the hospital bills. Okay, this young lady here had no health care. Then her boss got rid of Impact and decided to get it. She worked for a roofing company. She fell through, fractured her leg in 2 places. Her bill came in at $230.21. This number right here, the 179,840.57, is the amount that Impact negotiated off of her bill. Michelle, could she do something else with that money? Could she do something else with that $179,000? Could you invest it for her in another way? Okay, see my point? Okay, so again, this is what we charged her. This is what Impact took off the bill. So her bill was actually only $28,172.64. We shared in this amount here as members, and this is what she was responsible for based on the deductible she selected. Okay? One more thing that we don't hear from the panel. This gentleman here, he's been in insurance for 25 years. He's going to show you some of these bills that are, I think, criminal.
Also, we have Dante.
Criminal.
Dante's out of Southern California. He's got a unique perspective because he has many years of experience actually as a commercial insurance professional. And, Dante, I know you've got a pretty amazing story today on a couple of different examples of what Impact has done for some of your clients. I'd love to have you introduce yourself, share a little about who you are, and, why you love Impact. And, thank you for sharing the examples that you shared with us here today.
Well, thank you. Hi, my name is Dante Lucchese. I've been a commercial broker for about 29 years. I've been doing group medical and individual medical forever, so I'm pretty good at this. I came across Impact from a client of mine, said, hey, I got this new Impact company, and I said, be careful, because it's a religion-based company. Well, he sent it to me, and I spent about a week to look into it, and I've been hooked ever since. And I'm offering this alongside all of my companies, group medical, and save them a ton of money. Now, I just want to share my screen real quick because I want to be really, screen 2, let me know if you can see it, give me a second. Someone give me a thumbs up if you can see my screen, please. Perfect, okay. Now, this happens to be one of the examples of how Impact restructures the price 72 to 75%, sometimes more. This happens to be my nephew. He is a 33-year-old, strong, hardworking. He came down with what's called valley fever. Valley fever is a fungus that goes into your lungs, attaches your lungs, goes into your spinal cord, and goes into your brain and literally kills you.
Can you see?
Gee, it's not diagnosed. So he was in the hospital for 15 days. This is all of the laboratories work and so on now. In that 15 days, the bill was $214,434. Impact, right off the get-go, took off $179,713.
Look at these
remaining
line
balance, that $214,034 remaining. He had to pay his $150.
It should have been $9,500.
Yes, he was in.
Most people get a book and don't know what to do with it.
Then he had to pay his $2,500, and the rest went out to sharing. So after he paid his $2,500 deductible, okay, then he had a remaining balance of $1,415. So he paid his $2,500, then he only had to pay 10% to additional $5,000. Out of $214,000, he didn't even reach his max of additional $5,000 out of pocket. That's amazing. Now I want to show you something, Bill, from another client of mine that's about twice as big as this one. This is a commercial roofing company that I insure, liability, work comp, and group back, everything for these persons. This company, this is the owner himself. He had a stroke, and it was pretty bad. He was in ICU for a week. We almost lost him. This bill for Desert River Regional Medical Center from him was, ready for this? $539,550. Let's just say $540,000. Impact took off right at the get-go $515,817. Are you kidding me? So out of that $539,000, there was $23,000 out for sharing. You see that right there? He had to pay his $150 because it was an emergency room. He paid his $2,500. Then there's $18,900 balance left. He had to pay his 10%. Out of the $540,000, he only spent $47.58 out of pocket. He did not even reach his max of $5,000 out of pocket. So this calculates to be about 94 to 95% they knocked off the bill. I don't know any other company that can do that. Now I'm excited because I'm offering Impact with all my groups. And just so you know, it's completely ACA compliant, which means you can offer it along any company. So if you have 25 employees, 10 take Impact and 10 stay on the regular insurance, it's a fantastic way for companies to merge both of these entities together. So.
Okay. And this here shows you what our dental vision discounts look like. Mr. Farrell, I know you had a vision experience with using the Carrington, so if you would share your experience, that would be great. Thank you. Mr. Farrell?
All right. Yes, I just recently used my Carrington, which they have the dental and vision also included. So I was able to use the vision part this past Saturday. I was able to get 2 pair of glasses with all the whistles and buttons and everything, transition lens and insurance and everything. And the 2 pair was $550.
What was the original cost?
With all the stuff they said, it was gonna be like $1,300.
Big discount, okay? Now, sometimes, Impact again has been around from January, will make 6 years, so not everyone is aware of who Impact is. And as I mentioned, they made the investment to be in every payer system in the country. Sometimes you get pushback. I went to Baptist Medical Center and I gave them my card. And she said, oh, we want to take this. I said, yeah, you do. Yeah, you do. And she said, oh, she put it in. Oh, you take it. Yeah. Sometimes they just don't know. So sometimes when they push back, you have to push back. Okay? So Mr. Elliot, I know you're the king of pushback. So if you want to share your story, Dr. Joyce talked about her prescription experience. So if you will share your story with how when you went into the Cairo and how you had to do some of those, getting people informed to what we have.
Well, first of all, my name is Michael Elliot, and through Miss Lorrain, I joined BNI, which I hold a health seat in that chapter. And I'm telling you, I'm a person that loves impact, and I love talking about it. Now, before I get to the other part, but let me say this. I'm a heart attack and stroke survivor. And 3 years before I had my heart attack, I'm that guy you meet in the mall. Excuse me, sir, you got a few minutes to answer a few questions? Well, I'm the guy that always participated. So 3 weeks later, I got a letter in the mail, and the letter read, this is a test that you can take that may help you prevent you from having a heart attack and stroke. Now, I consider myself as healthy at that time, and it was only $25. But make a long story short, I think God led me to take a picture of that. I took a picture of it and just forgot about it. 3 years later, guess what I had? A heart attack. A year after that, I had a massive stroke. I don't know. Let me give you this disclaimer. Sometimes I'm not getting upset. Sometimes I get excited. So that's my disclaimer. I'm not angry, I just get excited. Okay, all right. So I just want to make that clear. Dr. Joyce is rubbing my back. I'm not angry, ladies and gentlemen. I'm really not. I'm not really not. But I just get excited because I know what the healthcare system, and I thought I had the best plan. I'm retired military, 34 years, Army, and I thought I had the best plan, TRICARE for life. So when I had my heart attack and stroke, they actually came, I was at Brooks Medical, and the safety manager, the health manager came, she said, Mr. Elliot, TRICARE is no longer going to cover your physical therapy, occupational therapy, and speech therapy. Ladies and gentlemen, I was about to lose my daggone mind. Yeah, and I thought, just like Dr. Joyce, I thought it was for life. And I think it's almost time you start going to mental health. Because why the heck would you do that to me after I gave this country 34 years of my life? I'm confused. So, Dr. Joyce, I'm all right. I'm all right. But the thing is this, why would you do that to me? And that's what started my journey. Why was it done to me? So I'm glad I joined ACN. Because one of the reasons, once I started learning about impact, wait a minute, this is what I need to be promoting. Because my heart attack and stroke could have been prevented. Had I had impact, guess what? I could have got the test done. Yeah, sure. So I want to say all this. I love talking about impact. Because just like my business card said, we are disrupting the health industry. That's no joke. And I love talking with insurance agents. And any insurance agent, they know that. Because they know I got a daggone answer for everything they got to say. Because I ain't playing with them. Because they know that half them jokers will be in jail for the money that they charge them for. Amen. So all I'm saying, take a look at impact.
Thank you, Mr. Elliot. Thank you, Mr. Elliot.
Okay.
I'm Rodney Black, and he actually came all the way from Texas, and he's one of the executives. Actually, every one of the panel is an executive in our company, but Rodney's going to kind of close us out.
Why do I have to go after Elliot? I mean, I'm gonna have to wake up. Dang. So yeah, I'm from Texas. My name's Rodney Black. I grew up on a farm, believe it or not, from Texas. And if my Texan slang gets in the way, just give me that puppy dog look, and I'll say it again. Right? But I'll give you my story. I am a meat broker by trade. I own a meat brokerage. But I've been in the meat business for 32 years. And I got involved with this business that we're all a part of 2007 roughly, so about 19, almost 19 years ago, right? And 2020 came along. The company I was working for went out of business, right? And I had to go purchase my own healthcare. Now, Jessie asked the question originally, how many people have healthcare, first of all? You pay for healthcare? Right? Who doesn't? Don't have to answer that question. But here's the reason I'm bringing this up front, right? How many of you are entrepreneurs and owning a business? Okay? That was not me until 2020 happened. And then I got pushed into launching my own meat brokerage. So I had to go shop for insurance. Prior to that, the company always covered me. So I really didn't study it, I didn't understand it. 2020 comes along, and thankfully it was the right move for me. I had to go get Blue Cross Blue Shield. It was $1,300 a month, and I think I had a $20,000 deductible. Now that was in 2020, right? And I was thinking to myself, and that was a family of 4 at the time. We launched this service with Impact in 2021, is that right? 2020 is when we launched it. I hadn't heard about it yet. So here's another piece to this puzzle. Have you heard Christian Care Minister? You ever heard any advertising?
Yeah, all the time.
All the time, right? Have you heard Impact advertising? You know why? Because we're it. We are their advertising vehicle. So from an entrepreneurial standpoint, when this came along, I was like, holy smokes. You mean I can go cut I cut my healthcare costs in half and got better coverage, right? So the only way people are going to be educated about what we have to offer is if someone tells them. Impact only uses ACN as their advertising channel, right? So for the entrepreneurial person, it's a great opportunity because you're doing people a huge service for something they know they need. And every single person in America right now is like, what am I going to do? Right? So if you're looking at this from either a saving standpoint for you and your family and get better health care, that's great. But there's 2 avenues, both. And I would highly suggest you take a deep look at it. My short story, I got the service because obviously I'm offering it to people. I want to know how it works. I'm fairly healthy, got high blood pressure, you can imagine. But it doesn't count towards me. They don't hold that against you, right? Not high blood pressure. In October of 2025, I fell off a curb, hurt the shoulder. Pretty bad. Went to urgent care in Lubbock, Texas. And like Lorraine was talking about, I was thinking, okay, I got the service, I haven't used it. Unfortunately, I had to hurt myself or get sick to realize just how good it actually is, right? Fell off the curb, went to the urgent care. I was there for 2 hours, got the bill. They did an x-ray, the bill was $535. I had not met my PRA, which is what we call a deductible, but they negotiated it down to $135. And I thought, oh, wow, this is real. I'm going to get behind this. Fast forward, I went to my primary doctor, who referred me to another doctor, so I got an MRI to see how bad it's actually torn. That MRI was $1,300 and something. Still hadn't met my PRA yet, right? They negotiated that down to $400 and something. So I paid out of pocket $400 and something. Now, I thought to myself, wow, this is amazing. So my annual renewal come up, I lowered my monthly or my annual share, right, my amount, to, that's $2,500 for my family, right? So when I have this surgery and I use the wellness rewards, I use light wave therapy and go to massage therapy, so I'm maximizing that $150 a month. This surgery on my shoulder might cost me $100 out of pocket. So I share all of that with you guys to say, hey, this is a real deal, right? His excitement it's legit. It's legit. And anyone that's when you see those big numbers, you're like, how is that even possible? Well, until you understand how the whole system works, and you really dig down into it, you're like, holy smokes, these guys they're making, insurance companies are making tons of money.
That's right.
And we can't, the only way that we're going to share it is to tell individuals, person to person to person, because that's how we do this. That's all I have. Thank you guys. Back to you, Lorraine.
Thank you very much, Mr. Rodney. Everyone with the part of ACN sitting, would you please stand up so people know who you are? Terry Ingram, Austin, please stand up. So if anyone wants more information in regards of, with the service, we talked about impact specifically, we have a whole portfolio of services that we offer as well, all things small business, but to speak to anyone on the panel, myself, or anyone standing. Merry Christmas to you all. Thank you very much, Mr. Randolph Love. So we appreciate you.
All right, give it up.